Hello, my name is Jasmine Perry, and I am a recent graduate of Montclair State University. I have a master's degree in clinical psychology with an emphasis in forensics. So, what that means is my background is in the criminal justice system and looking at the psychology of criminals and looking into different agencies and policies and see which one is the best. So, my goal is to bring mental health awareness to agencies that deal with criminals and make sure that the recidivism rate is going down because of, say, somebody just had a mental health crisis and they ended up killing somebody. That doesn't mean that they should stay the rest of their life in jail. That means, okay, well, let me get to the bottom of it. Let me interview them, see what happened, and see what kind of services they rate. Mental health means to me is when you are not in the right state of mind due to stress, grief, a traumatic experience, or anything that has made a significant impact in your life. Mental health can take many different forms that most people cannot recognize unless they have been trained to seeing signs of a disorder. Mental health has always been around, but it is not until recently that we have paid more attention to it as another medical diagnosis. Mental health is very important to recognize because you don't know what somebody's been dealing with for how long. And if somebody really needs help, you want to be that person to help them, and or if you can't help them, point them in the right direction. Mental health is important to the community that I serve because it is not talked a lot about in the criminal justice system. Most agencies have no idea on how to deal with someone that is going through a mental health crisis. Some deaths could have been prevented from the officers on the scene to identify when somebody is not in their right state of mind, and they can use less force in trying to get them to comply. As for those that are behind prison walls, that doesn't make them exempt from seeing a therapist or getting the treatment that they need for whatever traumatic experience led them to commit a crime. And it is important because most people think that once you're behind bars, that's it. You're not, you're just done with the world. You're beneath everybody. You don't rate any services. But in all actuality, some offenders, if they got treatment when they were younger for whatever reason that they started committing crimes, they probably in their adulthood wouldn't be in the situation that they are now. Now, I'm not saying that, oh, if they got help, they wouldn't be a criminal. No, because, everybody is a product of their environment. Now, if they got the help that they needed, they would have less risk of committing a crime that they committed. But I'm not saying. I do think Africa needs homegrown interventions when it comes to mental health because it is a different way of life compared to the rest of the world. Even though Africa is built up with many countries, every country has a different way of living, and you also have to take into account the different beliefs and the governments and everything else. So, for my experience going to the continent, I visited Nigeria, and definitely it is a different experience from me living in the United States. There's a different way of living, there's a different way of mentality on how everybody needs to get by. And just because America uses certain interventions that work for us, that doesn't mean that it would work for the same for Africa. So with Africa, it is assumed that everybody is going to the pastor, to the bishop, to whoever in the church leaders when they have a problem. And it is assumed that, hey, the pastor, the church leaders can help me. But if those leaders don't recognize when somebody is going through a crisis, how much help can they get? Because before the mental health disorder can go into its grandiosity and then the pastors have no idea what's wrong with this person, they should be aware of, okay, I can identify this sign, I can identify this sign, since they are pillars in the community and everybody comes to them.